Prescription is a written order given by a registered medical practitioner to a pharmacist to prepare and or dispense medicines for the use by the patient. Only allopathic doctors can prescribe allopathic medicines. As you know, being an allopathic doctor, you cannot prescribe homeopathic or Ayurvedic medicines. Nursing staffs, pharmacists and practitioners of traditional complementary system of medicines cannot prescribe allopathic medicines. Doctors should refrain from prescribing medicines of other systems of medicine. This amounts to cross practice or cross-pathy and is prohibited by the Supreme Court. So, you being an allopathic doctor cannot write a homeopathic or an Ayurvedic medicine. You can only write an allopathic medicine, and vice versa for them also. Okay, they cannot write. For example, in many cases you will find that patients are getting treated by a homeopathic doctor or an Ayurvedic doctor, and they refer the patient to take the antihypertensive. Okay, they tell the patient, you go and check, control your diabetes by taking antidiabetic or taking antihypertensives. So, don't do that. You counsel the patient that no, you are taking homeopathic medicine or Ayurvedic medicine, you continue on that. Okay, you take Ayurvedic antidiabetic or antihypertensive. Don't mix both the prescriptions. Okay, because there is unknown drug interactions. You don't know what is the composition of those drugs. What is extemporaneous prescription? The doctor directs the pharmacist to prepare and dispense the medicines. This is an old one. Extemporaneous মানে আগেকার দিনে কি হতো যে ডাক্তার বলে দিত যে কম্পাউন্ডারকে যে আপনি এইটা করে মিক্স করুন, করে এত ml পেশেন্টকে দেবেন। কম্পাউন্ডার ওষুধটা মিক্স করতো, লাল ওষুধ, নীল ওষুধ এগুলো মিক্স করতো, করে সেটা কোয়ান্টিটি পেশেন্টকে দিত, পেশেন্ট সেটা খেত। অর্থাৎ কেন না তখন এই ড্রাগ ফার্মাসি কোম্পানি বা এই কনসেপ্টটা তখনও আসেনি। সেই যে প্রেসক্রিপশন গুলো হতো তাকে বলা হতো এক্সটেম্পোরানিয়াস প্রেসক্রিপশন। আচ্ছা, যেমন এর উদাহরণ কি, যেমন দেখো প্রেসক্রিপশনের পার্টস কি কি তাতে দেখে নিচ্ছি। সুপারস্ক্রিপশন, সুপারস্ক্রিপশন হচ্ছে ডিটেলস কি কি থাকছে, ডক্টর নেম, কোয়ালিফিকেশন, রেজিস্ট্রেশন নাম্বার, ভেরি ইম্পর্টেন্ট, রেজিস্ট্রেশন নাম্বার মাস্ট বি দেওয়া, অ্যাড্রেস, কন্ট্যাক্ট নাম্বার, then date of the prescription, patient's name, age, sex, address and contact number. Contact number may not be needed, but you may write. What is the meaning of RX? RX means take thou, means you take. Inscription key, body of the prescription. For example, benzoic acid, salicylic acid and whites of paraffin. So this is an ointment basically. Okay, benzoic acid ointment or salicylic ointment, whatever you can tell. Then there is subscription, that is mix and make an ointment. Subscription is directed to the pharmacist. Okay, because this is an extemporaneous prescription. Then transcription, to be applied to the affected part twice a day. So transcription is directed to that patient. Okay, then full signature of doctor with date, full signature. Okay, not short. Now what prescription we follow? That is pre-compounded. That means we don't have to mix or make the drug. We tell that you take telmisartan and hydrochlorothiazide this much time at this point and continue taking this. And patient goes to the medicine shop and they get the ready-made medicine made by a pharma company. Okay, so this is called pre-compounding prescription. The doctor directs the pharmacist to dispense the ready-made formulations of the medicines. Okay, so this is ready-made medicine, no compounded in the chamber. Now we see Dr. Satyadev Singh, MBBS, MD, registration number, address, contact and date of prescription. Then for Kamalesh, 35 years, male, address ato, contact number ato, RX. Then you see this is the direct transcription. Okay, because this is directed to the patient. Okay, what is the difference between dose and dosage? Dose হচ্ছে কি যে এখানে বলছে কি ট্যাবলেট ciprofloxacin 500 mg. So 500 mg is the dose. Dosage কি, you are telling tablet ciprofloxacin 500 mg, you take one tablet in morning and one tablet in evening. So ciprofloxacin 500 mg BDPC for 5 days, that is dosage. Okay, that is the difference between dose and dosage. Then there is full signature. This is a wrong thing. You should not do short signature. Full signature in blue ink. Okay, in blue ink. Why? To avoid photocopying. Even if the prescription is typed or printed, the doctor must sign with date in blue indelible ink. Must sign as close to the possible as the last drug listed in the prescription. So signature should be very close to the last drug. There should not be any gap. Okay, because that gap can be later misused, specifically in case of addictive drugs. Okay. Overwriting on a prescription should be avoided. In case of overwriting, doctor must initial each correction, which probably nobody does. Doctors in prescription should clearly mention full generic name of drugs in capital letter. জেনেরিক নেমে প্রেসক্রিপশন লিখতে হবে, ক্যাপিটাল লেটারসে ওষুধের নাম থাকবে, জেনেরিক নাম থাকবে, তার নিচে তুমি ব্র্যান্ডেড নাম লিখতে পারো। দ্যাট শুড বি আইডিয়াল। ডোজেজ ফর্ম ক্লিয়ারলি, স্ট্রেংথ অ্যান্ড পোটেন্সি for ADC of each ingredient, dose to be taken, frequency of administration and duration of therapy. Clear cut instruction about all these things. For prescription to be dispensed once, right, should not be refilled or do not dispense more than once. For example, you are prescribing a morphine injection or a pethidine injection. You know that the injection may be misused later. Patient may show the same prescription again and again and take the medicine. Okay, so to avoid that, you write injection pethidine, full signature, what is the quantity, 1 quantity, 2 quantity, and write do not refill again. So it will be only once given. Okay, note repeat submission allowed. If once prescription to be refilled, then clearly mentions how many times it should be refilled. Okay, that's how you prevent addiction or misuse of the drug. For some drugs, a maximum dose may need to be stated. For example, ergotamine in migraine and colchicine in gout. How many times you take ergotamine in a day? You fix that. Don't take more than 3. Okay. For example, ergotamine 1 milligram at onset of attack and repeat every 30 minutes if necessary. Do not take more than 6 milligram in 1 day or more than 12 milligram in a 1 week. Okay. If a doctor is prescribing the drugs on hospital pad, then must put a stamp below the signature mentioning full name, qualification and registration number. That's why stamping a registration number when you are checking a patient or writing a prescription in a hospital setup or in some diagnostic report, a clinic pad. Okay, then your stamp must be there on it. Okay. Dekho, U abbreviation, it can be mistaken as 0. So better you don't write U, you write unit. For same IU, international unit, may be mistaken as IV or 10. So you don't write IU, write international unit. QD or QOD can be mistaken as daily or every other day. MS, MSSO4, MgSO4, confused or one other. So write morphine sulfate or magnesium sulfate. So this is morphine sulfate, this is magnesium sulfate. Two are different things but can be confused like that. So decimal points, that's also very much important. You see 5 milligram, you don't write 5.0 milligram, write 5 milligram because it can be mistaken as 50 milligram. Always at the same time don't write 0.8 ml because it can be confused as 8 ml. So write 0.8 ml, right? Rules for writing quantity of a drug. Quantities of 1 gram or more should be written in grams. For example, 2 gram, not 2000 milligram. Okay. For example, glimepiride 1 milligram. Okay. But metformin 500 milligram. But 1 gram, not 1000 milligram. Okay. Quantity is less than 1 gram but more than 1 milligram should be written in milligrams. For example, write 100 milligram, not 0.1 gram. Right? Quantities less than 1 milligram should be written in micro nanogram as appropriate. Okay. For example, L-troxin, levothyroxine 25 milligram, 25 microgram. Okay, or 50 microgram, like that. Do not abbreviate micro nanogram since that can lead to prescribing errors. For example, write 100 microgram, not 0.1 milligram, not 100 microgram or not 100 microgram. Ekdom write এইভাবে microgram করে লিখবে. Don't write mu g. Okay. Basically, try to avoid abbreviations. Letterheads or prescription blanks should be kept secure to avoid misuse of blank prescription, especially by miscreants and addicts. Doctors should not use another doctor's prescription pad even with his consent. Don't ever use that. Doctors should avoid using prescription pad having names of 2 or more doctors. Doctors should not use prescription pad with message at the bottom available at XYZ medical store. Doctors should exercise caution while prescribing drugs which have potential of abuse. Doctors should avoid recommending medicines on telephone or SMS. Don't ever do that. Okay, there is a lot of problem in telephone. Right, tell me some drugs that can use. No, you tell me that you come to my chamber, I am writing a prescription and sending a PDF. That will do. But don't tell something or write in WhatsApp. This can be misunderstood. While the prescription for family members and relatives also, write the prescription for family members and relatives also. আমাকে একটা ওষুধ দিয়ে দে না, ওইটা নয়, একটা প্রেসক্রিপশন করে দেবে, বলে এখন নিয়ে নাও, আমি একটা প্রেসক্রিপশন পাঠিয়ে দেবো। That is important. Discourage them from asking for medicines without a prescription. একদম, never ever do that, specifically in case of close relatives. একদম, doctors should always encourage the pharmacist to call them up in case of any problem or doubts or queries in their prescription. Tell the pharmacist that you can call me, okay, if you are not understanding, but don't guess and do something. Don't do that. Doctors must make a point to visit their neighborhood pharmacist once in a while to learn how they work, what practical difficulties they face, or find out whether they have any problems with their prescription and their legibility, and should ask for suggestions to doctors prescribing. Leave it. Pharmacists are authorized to refuse dispense prescription which do not conform to the guidelines, and if do so, liable for prosecution. Okay. For example, see poor handwriting. Okay, you cannot understand anything. Okay, only a pharmacist can understand. Okay, so poor handwriting contributed to medication dispensing error that resulted in a patient with depression receiving anti-anxiety agent Baspar instead of Prozac. Okay, so আমি তো বাসপারও বুঝলাম না, প্রোজাকও বুঝলাম না। দেখ a hypertensive patient accidentally received Vantin 200 phenytoin instead of Vasodac 20. That means Valsartan 20 when a pharmacist misread this prescription. Right? So every prescription is the beginning of a new experiment. Right? Same drug but new body, new human being, new genetic makeup. So every prescription is the beginning of a new experiment. Begin it carefully, remain vigilant, make the patient healthy, and get blessed from the Almighty. Thank you very much.